Support comes from Hampton Roads Community Foundation, partnering with donors from all walks of life to improve southeastern Virginia through grants, scholarships, and leadership initiatives. Learn more at hamptonroadscf.org.
Hello, everyone. I'm Barbara Ham-Lee. There are many reasons why we may experience mental health challenges. Adverse childhood experiences, loss of a loved one, major life changes like homelessness or unemployment, substance abuse, stress, the list goes on. These factors affect us all, but for African Americans, there's also racism, lack of resources, gun violence, poverty, and stigma. So why are Black people less likely than whites to be correctly diagnosed with mental illness and also less likely to seek professional help? Up next on Another View on Health, a frank discussion about mental health and how to improve mind, body, and soul. Another View will be right back after this news from NPR and WHRO News.
Discussing today's topics from an African American perspective, this is Another View.
Good afternoon, everyone, and welcome to Another View. I'm Barbara Ham-Lee. Mental health. We don't like to talk about it much in the Black community. In fact, we dismiss stress as just life, or we joke, he's just a bit touched in the head. But mental illness is real, and today we hopefully will provide you with a different perspective about taking care of our minds. Joining me today are Norfolk Councilwoman Danica Royster, who has played a key role in bringing the community together to talk about mental health and wellness and speaks freely about her own struggles with mental health. Hello, Danica. It's good to see you.
It's good to see you too, Miss Lee.
Thank you for being here. I appreciate it.
Thank you for having me.
Dr. LaConda Fanning, she's a clinical psychologist, licensed professional counselor, and director of the Graduate Medical Education Early Assessment and Mentoring Program at EVMS. And we welcome you, Dr. Fanning. How you doing?
Thank you very much. Nice to be here.
Thank you so much. And of course, our favorite cardiologist on the planet, Dr. Keith Newby, my co-host. Hey, Keith, how you doing?
I am doing well, and yourself?
I'm doing great, and you're in the studio.
Yeah, I tell you, this is like 3 times in a row.
I know.
I'm breaking all kinds of records.
Absolutely. So I want to start first of all with a baseline. And audience, I did ask Dr. Fanning if it's okay if I use her first name, so, don't trip. But LaConda, there's so many different terms. So there's mental health, there's mental illness, there's mental health disorders, are they interchangeable or do they mean something different?
They typically should not be. However, most people, when they think about mental health, the idea that comes to mind is mental illness, which is the extreme. Mm-hmm. Everyone has difficulties with ups and downs in managing their mental health.
Okay.
Right.
Okay.
And so that's something that we all struggle. But when it begins to impact functioning, then it starts moving towards mental illness, and then you go to the diagnosable place.
And that's where you get things like schizophrenia and things of that nature, and depression and stress.
All
and
of those
all
diagnoses.
Of those,
even though on this side of mental health, which is what we try to normalize and not stigmatize, we all have bouts of anxiety, depression, and have to do things to make sure that we protect our mental health.
So, Danica, last month was Minority Mental Health Month, and I know that you pulled together a big community conversation in Norfolk about mental health, particularly in the African American community. What were some of the things that people were telling you about?
So the way that it was called Surviving Through Mental Health, and it was a collaboration between myself, Shanice Hernandez with Project ORF, a local nonprofit, and the Norfolk Community Service Board. And what I wanted to do is recognize the fact that we are literally experiencing trauma on a daily basis, particularly in the part of the city where I represent, Super Ward 7, where we're consistently having conversations about food deserts, healthcare deserts, gun violence, domestic violence, and particularly our kids are experiencing this on a daily basis with this expectation to perform with a lack of resources and a lack of accessibility to some of the things that we talk about, particularly healthcare, and that is mental health care. So with the panel that we had, the first one was a professional panel, and they were just talking about, breaking the taboo, breaking the stigma, and particularly how it impacts the lives of Black people. Generationally, we have had 400 years of trauma since we've come to this country, and how inherently it is in our DNA, and oftentimes it can show up physically and mentally. The second part of that panel is where we had the youth actually come and share their experiences, along with some of those who work with our children on a daily basis. And what I can say, I mean, we were just talking about high school reunions. I've been out of high school since 2007. And the whole level of bullying is just even completely different. Cyberbullying, there's one kid who, expressed that, imagine like your phone, like people consistently sending you stuff, social media. So it's not even like, okay, I get to go home and this is a safe space. No, it's all
because
around
it
us.
comes right into your home.
And all of our kids are also on the
phone.
technology. There was a saying when I was growing up: "Sticks and stones may break your bones, but words may never hurt you."
Right.
That is so not true. And we have kids where I think one of the percentage of child suicide is like off the charts. And you have kids who are in Norfolk Public Schools expressing to us like, we need help. The guidance counselor is great, but that is not a trained therapist to help me with what I'm going through. And they were basically saying, my parents are doing the best that they can with what they know. And when we talk about generational understanding of mental health, it could be man up, get over it, put your big girl panties on, stuff like that. And it's like, that's not helpful. So they're talking about what they've been suppressing, and all I need is an outlet. And is it okay that I'm not being okay? And for me, that whole conversation was serving the purpose of awareness, breaking stigmas, but also I hope serving as a launching pad for what are we doing that we could do different to help the next generation and the current one? Because I never want to take away from someone's parent or grandparent doing what they only knew. But this also served as an opportunity. So how can they educate them and recognize, okay, yeah, her grades are slipping, her behavior, maybe it's not just her going through a phase, maybe something else is going on. And then part 3 of that is at the end of the conclusion of the conversations, we actually had a mental health vendor fair where we had everyone from Centera, CHKD, nonprofit organizations, actual healthcare providers who meet people where they are regarding those who are on Medicaid or need assistance, because we wanted to make sure we are covering the basis of not only educating, but providing access to available resources for people to say, this is where I can go to get help.
So Keith, do you take into consideration someone's mental state as you're dealing with their physical?
Yeah, you almost have to. I mean, it's the psychological portion can impact the physical, and a lot of times when people come in with chest pain or shortness of breath or palpitations, like, irregular heart rhythms, you'll find once you start digging, but that's why history and physical is so important. Some of the younger docs I've been a little disappointed with in terms of their, everybody's so phone oriented and texting that they forgot how to communicate. And I'm seeing that, they don't really know when they start an interview. You have to look at the person's body language. You have to kind of see them where they are, and when they start responding back, you have to feed in on those responses and know if you see certain cues that, okay, they're getting a little antsy with what I'm asking them, so then I have to back off of that and go down another path to get to the same information. But that takes skill to learn and to implement, and I think that's where where a lot of us are falling short in healthcare, is recognizing that piece, because I'm finding a lot of times mental health concerns do impact the physical, and a lot of times people with palpitations, you find that they're just anxious about something.
They're having anxiety.
Yeah, so you have to really learn to talk to them about the social history. And that's where I'm finding we fall short, is like, what's their home environment like? What's, their upbringing? There are things that you'll find impact that, that physical part, that the mental part impacts the physical part, and that's where you see it. So it's just a matter really of talking to patients, but knowing when to move forward and when to back off. And once you know when to back off, then you let them talk. And a lot of times I'll ask open-ended questions. Tell me about yourself, and you let them talk, but again, we're so fixated on doing things quickly, we cut them off, and that's a problem.
So do you all, or are doctors trained to say you're having this conversation, you realize this person doesn't necessarily have a heart problem, but they need to be referred to someone else that can help them get through their anxiety or whatever it is? I mean, are they taught to do that kind of cross?
Yes, they are, but the problem sometimes, and it's a generational issue, and I say that, I don't mean just generational in terms of young or old. I'm talking about just the way things are now. You have to see so many people in a day that, and there's sometimes, like, I know if you hear that term, social determinants of health, and we talk about that a lot, the problem is if you're seeing, like, I'm seeing 30, 35 people in the office, I got 20 in the hospital, I mean, and so I had to see all these people, so that's why I'm up at 4 a.m., every day. But I say all that to say that, when you're seeing somebody and you could just read through all the problems and but you don't have time to get to that piece of it all. And that's the part that I really, in the office setting, we don't have that resource. Well, I would love to have a social worker or some type of community health worker that I had access to all the time that I can say, listen, this person got some issues. I need you to go and talk to them and investigate their home life. And some have some of that, but it's not like because these folks are stressed out, because they're stressed out because the demand's falling on them, and there's not enough mental health workers out here that are trained to know what they're doing enough to help. So you run into that shortage that and that's where I'm seeing a lot of problems is in the shortage of staff to address it. If you can get them, wonderful, but that's a tough thing, and the demands are steadily increasing.
Yeah,
but not that many
people going into the profession. 757-440-2665 or 1-800-940-2240 are the numbers to call to join our conversation. What questions do you have about protecting your mental health? What questions do you have about where to go in order to get the help that you may need? Or if you are a parent, are you looking at your child and wondering, is this serious enough that I need to go to a doctor, or is this just kind of because they're becoming a teenager? There's so many questions out there. 757-440-2665 or 1-800-940-2240. So LaQuanda, okay, I can go to you as a psychologist. I could go to a psychiatrist. I could go to a licensed clinical social worker. How do I know where do I start in terms of trying to find help?
First, the person that typically a minority or African American we're going to seek is somebody that we trust. So that person may be the pastor, a friend, someone that has some type of knowledge in mental health. The idea is once you get to that person, though, that you're given the right information. There's different levels of training, but we all have the ability to assess and diagnose. It's just how we treat you. It's different. So I may, as a psychologist, my focus is on assessment and testing and diagnosing, as well as treatment and can do therapy. However, we want to make sure that those social aspects and those social cultural aspects are not minimized, or that a person's lived experience is not devalued in the whole diagnostic presentation. And part of the issue with us is that our lived experience holds value on how we show up. Right. And so I cannot minimize the behaviors that I see are connected to my experience, right, and where I come from. So we have these complex variables, and you have to have some training. You have to know the impact on how behaviors show up, whether it's with our children or with our adults. I'll tell anyone, a teenager African-American young male is not going to be sitting in the corner crying anywhere. Yeah. Right, when he's depressed, but he might throw a blow at you, right? And he might again lay you out, right? Because his expression of anger and trying to deal with the depression or anger turns inward is different, right? Not minimizing that generationally, like we talked about, our values, beliefs, and traditions and how they play out in present. They are important. right? And so families have to be able to talk about, and you have to be able to challenge that. And as a diagnostician or as a mental health professional. So what were you told? What is your value? Because it influences how I'm gonna handle health. Even recognizing I'm even going to show up to speak to you, right? That trust that I have of mental health professionals or of practitioners of all kind. I'm not going to be honest. If you don't build a relationship with me and you don't address the report or show that you authentically care. So that has to be intention. So it cannot just be about, let me get my information. How tall are you? When the last time you slept? If you don't build that rapport, then I'm not going to give you that information.
You are sharing a lot of very personal things. So trust is paramount. I want to read this quote and get you all's response to it. So this is from a woman named Cynthia. And she said, mental illness in the Black community has long been a touchy topic. The overriding belief is that you don't go to therapy or counseling or take medicine. You go to church and you don't talk about your business to anybody. You put on your big girl pants and keep it moving. That's what I did, except I wasn't going anywhere. Your response, Danica?
I think that's one of the things that's plaguing our community is that, what is it? Be the strong friend, or I can do bad all by myself. And that's one of the things that's honestly hurting us as people. There's a lot of articles, once again, going back to data, looking at the higher rates of suicide in Black women and Black men. And then we'll see these stories, and we'll even like celebrities, and it's like, man, they seem like they had it all together. And well, this person had so much. And then it's uncovered later on that this person was going through something. And then the family will come out and say, I wish they would have known that they could have talked to me. Or why didn't people feel like there was an environment where they felt that they could be vulnerable? And I think we have a responsibility of being honest and vulnerable in the things that we go through. I've been very honest and upfront. I've been diagnosed with attention deficit disorder since I was in middle school. As an adult, I was always wondering, like, I have these mood things. No, it's depression. And then, I just feeling finicky. That's anxiety. And calling a thing and being able to stand up in it and show like you are not defined by your diagnosis, and your diagnosis doesn't define your destiny, is one of the things that I've been very upfront about. And it's okay to not be okay, but it's also okay to share with other people, because you never know who you're freeing. Because sometimes people have this image of what they think a diagnosis looks like, and to be able to show up in spaces and say, yes, I still struggle, but at the same time, I'm able to still be Norfolk City Councilwoman. I'm still able to be a good friend. I'm still able to be financial advisor, but I also recognize my boundaries. I also have a great village, which is encompassed not only of my family and friends, but medical professionals. I have a toolkit to help me along the way. And these are the things that you need to have in your playbook to survive through mental health. Because I think that that's one of the things that hurts us, is when you have to think I have to do it by myself, or I can figure it out on my own. And if I go seek professional help, then that's a sign of weakness.
Yeah, like I can't, why can't I keep it together? Everybody else out there is keeping it together. Why can't I do that? Yeah, if you don't go ahead.
I was going to add, you hit on so much, and this is the significance of normalizing mental health, or seeking help, or even having a conversation to talk about it. But also being accountable for our values, our beliefs, and tradition. Right. They worked for what they needed to. They built resilience and strength, but we also have to own that it stops me from even taking a chance. Right. Taking a chance. I have to challenge that. What worked for grandma, right? Don't talk about your business.
Right? Oh yeah. Keep that in the
that in the family.
Everybody
heard that, regardless of who grandma was. Right. But that was a value system, and it's something that we needed at that time. Right. But now we have to own, and sometimes I think one of the most powerful things that I do is allow the person to be free. So I'll usually call it out. Those generational things, those cultural things that influence you connecting with me, is to say, take a seat. Yeah. Right. You've done great. Right. But this is also what you need.
Right.
Keith, you're a deacon.
Very much
No,
so.
but I mean, seriously, so the church faith does not mean, and dealing with your mental health professionally is not a contradiction.
I think of what happens, like for me personally, that was a grounding thing for me personally, and I always tell everybody has to walk their walk the way they do. My wife really helped me with finding God again, because, when you're in medical school and all that, that wasn't my thing at the time. And then when I met her when I was at Duke, she had me in church every Sunday. But that was a good thing for me, because then as I kind of really got into it, I found that was a stabilizing factor for me. And then you find if you have a good church family. Now, one thing I tell people all the time, I mean, these are still humans. Mm-hmm. A lot of people I've had people that will tell me they got upset and they left the church because of what somebody did. I'm like, but you're not there for them. You're there for you get your Jesus on. Mm-hmm. I said, if that's the case, I said, what these other people are, they're just just part of the big puzzle. I said, but don't let them take you down a different path. So I say all this to say that you have to find that which is where your inner peace comes from, and then you roll with that. But that's not for everybody, and when I talk to people, I don't try to push anything down their throats. I'm just like, I let them talk, and if they bring something up, I'll we'll discuss it. But I found that everybody has a different grounding force, but for me, and I think it has great potential. That comment I think that the person read talked about, we go to church. People don't go to church that much anymore, though. That's so. And now I'm not saying that knocks anybody, but I found that sometimes having like that village, who helps you, because the family dynamic has really fallen away. When you really think about it, when I was growing up, if I got in trouble, and Lord knows I did quite a bit, I would have a neighbor or somebody would call my mom up, and next thing I know, I'm Keith. So but that has fallen away in a lot of circles, and you don't find that I don't know, and you could probably share more about how things are now versus, like, say, 20, 30 years ago, how things have changed and how that may influence, some of the dynamics that we're seeing. And if you have, that to me is where I think it is. How much of that influences, I think it does, absolutely. But weigh in, please.
We the community, and that again, it's not minimizing the role that the community and social connection plays on mental health. Having someone outside of your immediate family, right? Being able to have that social connection and talk and play outside, and those type of things have value in mental wellness. Right. Can you think about
mental wellness?
Absolutely. And with the system, or even working, most people work 2 jobs. Most people work 8 to 12 to 16 hours a day. And so the life and the external factors doesn't support mental wellness. Right. And so that's why it's so important to make yourself a priority. Right. And so setting up, making sure you go out, right. Go on those lunch dates. Right. And so one thing that our internal families don't do or haven't been able to do is see what mental health looks like. Give us a good picture.
I was going to say, because, and hold on one second, because I don't want to get into that whole discussion. Before I do this, if you're just joining us, we're talking about minority mental health with Norfolk Councilwoman Danica Royster, clinical psychologist and licensed professional counselor Dr. LaConda Fanning, and my co-host for Another View on Health, cardiologist Dr. Keith Newby. 757-440-2665 or 1-800-940-2240. Modeling good mental wellness. Because we talk about mental health, we talk about mental illness, but rarely do we hear mental wellness. So if you're in a situation, I guess, how do you know that you are in a more positive situation versus what may just seem to be normal because that's what you do every day? Does that make sense?
It does. And something that's coming up for me is mental wellness and mental mindfulness, and going back to accountability of how something makes you feel. So we were talking about generations and, my particular generations and those after me, social media. And like, there's so much information out there with access to the internet, some good, some bad. One, I know mental wellness practice that I have is I'll take social media breaks. I have a firm belief that your feed feeds you. So what are you subscribing to? And you have to sometimes do a check on how does this post make me feel? And for me personally, there's been pages and even persons that I'll unfollow because I'm an empath by nature and just by DNA. And I'll just automatically be like, oh no, this is too much. And how does this, is this triggering me? Is this stressing me out? And how can I disconnect? And I think that that's a practice that we should get into more frequently. And it doesn't even have to just be on social media. It can also be with people as well and situations.
You're talking about boundary setting there.
Boundary setting. I was having a conversation with a friend of mine, and she even had to talk to me about how she had to kind of take a break from some of our groups. And she's like, because I found that, she's like, I enjoy the socializing. She's like, but then I also realized every time I'm out, I'm drinking. And at first I thought, I'm like, oh, it's just social drinking. But then it's like, I'm social drinking every week. And then I'm stressed. And then all of a sudden I'm at home and I'm just like, let me go grab this. Before I know it, it's not a glass of wine. It's 2 glasses. And then I've done a whole bottle in 3 days. And she said, I just recognized that what I thought I was just socializing, I was actually suppressing some situations and utilizing alcohol and being out socially to try to get away from something. And I told her that's a major step. And whatever I can do to support you in that, because, that will lead to alcoholism and some other things. And just recognizing that sometimes even our social behaviors, what we're consuming, it impacts us mentally. There's certain things that I just tell people, I can't talk about that. And I'm not trying to be short with you, but I have to protect my peace and guard my joy. And this conversation or this person or this situation isn't serving me because I recognize what my triggers are. And that is a part of minding your wellness. And I think that takes time. And sometimes it requires isolation, and that's okay. But also recognizing that there's nothing wrong with you saying no. A lot of us are hurting ourselves in trying to people please others, and all it does is impact us. You don't get
because they're going about their business,
right? You don't. I had my therapist, and I've been in therapy since 2017. I remember she told me, you're not going to get a medal for your martyrdom. No one's going to say, oh, here lies Danica. She did so much for so many other people and didn't take care of herself. And we are so thankful for what she did, and go on about their business.
Yeah.
She says you have to prioritize yourself. And self-care should absolutely be selfish. I know some people say self-care isn't, but no, it should be. Because you can only, my grandmother used to say, you got to take care of number one. It's like when you're on the airplane. If I don't, you got to secure your mask and then secure the other person. So in your mindfulness and your mental wellness, also adopting practices, whether it's journaling, whether it's going for a walk, a run, spending time with people who make you feel safe, joy, watching a movie. Those are things that are good practices. Some people say, was mental wellness taking a bubble bath? For some people it is. And you can't allow others to define what makes you feel well.
What makes you feel well. We had a caller who called in. She wanted to know how debilitating is the HIPAA law when it comes to helping someone struggling with mental health concerns. She said she wants to help a friend who's had a breakdown, but doctors can't divulge any of his medical history.
More so than it's, I want to say it's there for a reason. Right. And so one thing that there is always a lot of adults that are concerned about their family members and friends, and they feel like that they're the only ones, but they're not, they don't have access to his information. The idea is that if they're your friend and they want you involved, then they have to have their right to have you share that information or that provider. But it has to be a law. It has to be a boundary, unfortunately. And so sometimes having that boundary may not be helpful.
Well, I was going to say too, because like using Danika's example of her friend, that person seemed to be very self-aware of where, what their boundaries are and what was going on mentally. But if you have a family member who is not self-aware, what do you do? How do you get them to that place?
Yeah, there are systems. If you feel like a person is at harm or in danger, that's different.
Yeah.
Okay, that's different. When they're not aware and you feel like that they're being in harm, then there are systems out there to protect that and to give you the permission to advocate on their behalf. But most people are just genuinely concerned, but recognize that people are trying to accept their own illness and their own issues. And sometimes it's hard for us to accept that you may not want me in the issue. We assume because we are family or you're my friend that I want you in my business. Right. And the truth of the matter is I might have someone else and it may not be you, but we won't know how to say that. And that's a boundary issue.
Absolutely.
So go ahead, Keith. You want to add to that?
Listen, she said it all.
Right.
That's always the tough part in our world, even.
Yeah.
Because you do have to know, again, when to push and when to back off.
When to back off.
Yeah. So.
Let's talk to Kay in Suffolk. Hi, Kay. You're on the air.
Hello, my name is Kay, and I'm from Suffolk, and I just wanted to say that this is such a timely conversation, especially with everything going on now. I know for myself, I'm stressed out by the news, and I'll go for a month and not really look at the news, but I'll look at a few news breaks. But I also want to say to Dr. Newby that he really does practice what he preaches, because I had a situation whereby I was having what was just about like a chest pain, tightness in my chest. I have a strong family history of cardiac issues and so forth. And I went to see him, and he did just what he said he does today. He practices bridges. And it turned out I was fine. It was that stress. And a lot of times we don't recognize what stress we're all undergoing and how much is going on with us. Right now, I'm going through some things now, and I'm feeling a little tight, but I know I need to stop and take time for myself and do some things in order to take care of myself.
That's great, Kay. Please take care of yourself. Go ahead.
Well, thank you. Checks in the mail. Thank you.
Thanks so much for the call, Kay. We appreciate it. Let's talk to Joe in Suffolk. Hi, Joe. You're on the air. No?
Hello?
Yes, Joe. You're on the air.
I'm on the air. Thank
Yes.
you so much for taking the call.
Uh-huh. What's your question?
I love Doc listening to him, but he said something I had to call in. He said when he got in trouble, the neighbors would say, I'm going to tell your mom. And I'm thinking to myself, whatever happened to wait until your father comes home?
Well, unfortunately, my father died when I was 7, so I didn't have that growing up. But I did have some uncles that put their foot up my tail every now and then. But that is, you're right though. That is an issue. I mentioned the family dynamic has fallen apart, and that does impact, I think, tremendously on how we deal with stress and just life circumstances. Do you have somebody that can help advise you on how to handle certain situations? Because when you're young, you don't really know always the best approach, and that's one thing. My kids, especially my youngest, she and I are like just tight as all get out, and every time she runs into an issue, she calls me and says, listen, Dad, I'm dealing with this situation. How do I manage it? And what I try to do, just like with all my kids, I want to tell them what to do. I want to give them things to think about. I say, because I feel very comfortable that they are smart. They have
that they
the
can
ability.
Make their own
so
decisions.
I would give them feedback, and I'll say, okay, these are your things I want you to think about. And I want you to take that, think about it. Don't make the decision right now. And I have found that works for mine, but everybody's a little different. But I think that communication, that ability to to navigate with your kids or your family members, and not being where you're being overbearing, but you are being a support system. That's where I think we fall short sometimes. They will say, all you need to do is X. And I avoid that because my wife's got on me about that a few times. But I joke around with that, but she does bring that to my attention to say, when you're trying to tell somebody what to do, sometimes they may not always receive that well. Give them things to think about, and then let them make the decision. And I found that if that being that support system is very effective.
LaConda, I want to ask you about cultural competency, because you work in the graduate medical field over at EVMS. First of all, are doctors being taught cultural competency, and how important is that in making a selection for a mental health professional if you decide to go that route to take care of your mental health?
Two things. One, I would say yes.
Okay.
But I would say, like Dr. Newby mentioned earlier, two things with cultural competency is we don't see it as a moving practice, right? And so there's a standard of practice and standards of care. And so if you ask someone if they're competent, more than likely they would say yes. Okay. However, so I think cultural competencies is the basic foundation. Okay, but now there's a concept that we call competence and humility, right? Learning, going an extra mile, learning about the person's culture of the person that you're treating. That's different. Recognizing that we are still lifelong learners, right? And we don't have it all, right? And I got to tell you about you, but first I got to get to know you.
Right.
Right. And so, I have to be open to knowing that that's different. Right, from how I even understand. They may be different from even a lab that I see, right? And so it's very, very, very important to recognize that competency does exist. Yes, we are all being taught that foundation. However, right, the application and examining the barriers and getting to know the culture, then that's something that we have to continue to learn and move on. And then we have systems that may not support what the expectations are.
Okay.
Right.
So if someone wants to go get help, what are the questions that they need to be asking so that they can determine if this is the right fit for them?
It's a couple things. The first thing I just wanted to say before I answer that is you want a competent professional. Okay. Then you want a culturally sensitive one.
Right.
Okay, because I don't want to connect with you because you look like me. Right. And then you don't have the skills, talents, and
to take care of it. Yes,
right.
There you go.
You see, so I really want to stress that competency is mandatory. It's an expectation, right? But to ask, you can ask a provider, right? You can ask them, have you ever practiced in an inner city or underserved community? Or can I share with you my culture? That's always one for me. If the provider does not allow time for you to tell them about you or about your history, then that will be a warning that that's a wrong provider.
Tell the truth on that one.
Yeah. And can I?
What did you do, Danica, when you were looking for?
Well, the interesting thing is how I even started therapy. I had a client who is a therapist, and I'm her financial advisor. And so she was like, this isn't ethical. You can't be doing financial advice for mental health advice. You need to go find your person. And I was like, okay. So I did some research, and she helped me based off of she knows my personality gave me some names. And she said, interview them and just set up an appointment. And she said, but the biggest thing walking in is don't expect for after your third session, it'll be if you didn't fix me, then you're not it. And I was blessed that the first person who I had an appointment with, as I mentioned, she's been my therapist since 2017. Yeah. As a woman of faith, I definitely prayed before I went into every session. And I just, I sought God as relates to, is this the person who you're going to align me with to assist me on this mental health journey? And he answered my prayer. But also one of the things that I appreciated is my intake form. It wasn't just about this, that, and third. It was like getting to know me, about my likes, my dislikes, and then, how I want to be serviced and my communication style and things of that nature, which I thought to be profound. I wasn't expecting to see that on an intake form. And literally, like our first session, it was very much a get to know. I had a notebook because I'm like, Googling what are all the things that you need to have to be prepared for your first session. And then I had like my list of 1 through 10 things that I want to talk to about her. She was just like, okay, I appreciate you being prepared, but how about we just sit on the couch and let's just talk. And then I appreciate her for establishing a relationship with me, which made me more comfortable with wanting to be more vulnerable. I was already willing, but there's hesitancy of like, we say, I'm about to tell some of my business, and then also being within a community, particularly Hampton Roads, is like, okay, looking around, I'm like, okay, oh, she went to Norfolk State. I wonder if she knows so-and-so, or she go to church over here, oh Lord, and that means she gonna know this person. She might gonna say, oh, I'm seeing someone, but all of that got wiped away. And because I also, versus internalizing my concerns, I expressed them. And then she's like, thank you. And let me tell you, why you shouldn't be concerned about this. Number one, I ain't losing my job because of you. Number two, I ain't going to jail because of you. So now that we've established that, I was like, okay. And then like the personality, and then I just appreciated the fact that I was able to be vulnerable, and she provided me with tools. And I told her what I was seeking, and she basically told me whether she'd be able to meet that expectation or not. So I think that when persons are seeking a therapist, a psychiatrist, psychologist, also be prepared to interview that person. Because, sometimes you come in thinking like, okay, you're going to evaluate me. You should evaluate them too. Say like, are we a good fit? Because sometimes there are some disconnects. I've had friends who they sought a mental health professional, and they're like, I didn't like this person. We were the same age, and I just felt like it was too much girlfriend. And I'm looking for like my auntie type of situation. Or a guy was like, it was very like, this is my bro, this is my guy. He's like, I can vibe with him. Like this worked for me. So I think that that's one of the things.
So it's a very individual thing.
Right.
Also.
There's no one size fits all. And it's like, this is the perfect type of therapist for you, because we're all different. And particularly as Black people, we are not a monolith. So you need also someone who recognizes that, yes, we have, similar culture, but our lived experiences can vary.
Very different.
And you need someone to be able to meet you where you are as well.
So what if you find out that this person is not the right person for you? How do you gracefully get out? Do you just not show up for any more appointments? Do you say something?
No ghosting.
What do you do? No ghosting. Okay.
And that has happened many times. One thing that's very important for me is that connection. So I encourage you to interview me as I interview you, because I'm also going to come to a conclusion that we're not a fit. Right. If you don't hear that from your provider, that's also concerning, right? Because you are inviting me to every aspect of your life, right? And so I need to respect that vulnerability and what I'm going to ask of you, right? And so that's very, very important. And so if it's not a good fit, right, we'll talk about why.
Okay. Before you take them on
Absolutely.
So what if you start and you're into sessions and so forth, and something goes sideways? I'll give you a perfect example. I went to a therapist once, and when we started really getting into issues, the response that I was getting made me very uncomfortable. And so I just said at the end of that particular session, I will not be back. But
it's a couple things. For me, I always tell you, if when we get there, right, when I feel like we're getting to some points, some stuck points, or where change needs to occur, if I'll tell you at the beginning, I'm not going to say everything that you like, right? Can we agree that if I say something that really rubs you the wrong way, can you let me know if I don't tell you, right? But sometimes I'll prompt you with saying, this is going to be a tough session today.
Well, and that's the other part of it too, is because as you get deeper into the particular issues that you're facing, it becomes harder to listen and to absorb, what you're hearing as a professional versus what the patient is experiencing.
Yeah, but in a good clinician, good clinician knows to say, this is, I know what you're used to. When people challenge you or this gets real hard, this is what you usually do. So it's okay. Right. But I'm going to give you or help you find another way. Right. So if you shut down, let's find another way. What's uncomfortable in that? Right. I'm not judging you. You see, I'm not going to shame you. Right. And so let's kind of walk through this. So you have another skill set. You have another tool to use. Right. And so it's so important to just, again, make sure that, and because you can't leave them. Right. We don't have the option to just say, I'm not going to deal with you. I'm not going to work with you, because it's about trust. And one thing, we all have that number one rule of doing no harm.
Yeah.
And so we take that very seriously.
I think you will find on the medical end, or just in any relationship end, that the point you brought about building trust has to be the initial thing that's done. I find with me, I know I'm gonna rub some people wrong, but when I do that, they know it's because I care about them. And if I see them going down a path of destruction, which you get somebody like I got somebody coming to pressure 200 and they give me every excuse why they don't want to take a medicine. I'm looking at them like, really? I mean, we're going to go there, but
are we going to go there?
but what I'm finding that works for me is that initial, there's a couple of things. One thing I want to real quickly is that there has to be realistic expectations on both parties' parts about what they expect to achieve out of that. And I tell people, listen, we're clinicians, but we are still human. And sometimes we wake up on the wrong side of the bed too. And and if something happens, there has to be a meaningful discussion. I've had patients that would tell me, I'm not going back to this guy because he's said X. And I'm like, but were you getting something out of that relationship? And they'll say, yeah. I said, well, did you have the conversation with him first?
Right.
Or you just not going back? I said, who's going to be hurt in that deal? Because he's going to sleep fine at night. But you're the one that's having an issue. Yeah. So I said, instead of just writing that person off, why not go back and say, listen, when last time we met, this happened and that, that hurt me or that whatever. I said, just have the conversation with them and just see. Now, if they tell you go jump off a bridge, then, you have your rationale to do whatever.
I think this experience that I had from the beginning, I was not positive that this was right. And then the interpretation, I could tell that this person did not understand my life experience versus their life experience. And so it was, but again, I mean, I think there's a fine line between not wanting to hear the truth
and discernment
and discernment. Exactly.
I think you'll find also, you talk about cultural competency, that issue, and I've gone toe to toe with a couple of patients about that who was, when they talk about other people, they'll make a comment like, one thing, if you haven't had the lived experience, if you grew up in a situation where, your father wasn't there, your mother was on crack, and you had all this other stuff going on, I mean, that lived experience is going to put you in a place that you may not want to be. So for me to come in and say, and the term I always hate when somebody says, they just need to pull themselves up by the bootstraps. I mean, it just about drives me nuts when I hear that. And I tell them, I said, listen, your lived experience is likely different from theirs, and they are a unique individual with unique characteristics. You can't compare yourself to them and think they should behave a certain way unless you've lived in that person's shoes. And even if you did, that individual is still an individual who has, and that's what that's what God made us different. So I have to understand that when you're dealing with people, don't make assumptions about anything with them.
Absolutely. We got about 4 minutes left. I want to ask each of you to talk about some mindfulness that you do for yourselves? Because we're all professionals. And I was at a session recently where a very high-powered professional said, you know what? Professionals have therapists on speed dial.
Absolutely.
Because they've got to learn how to balance professional life and personal life. So, Danica, give us a couple things that you do for your mental wellness. I love that phrase.
Yeah. Well, one of my practices is I start every day with gratitude, whether I verbally express it. And some people, you can say it's your morning prayer. I journal morning prayer, or I'll do a devotional, because I just feel like it sets the tone of my day. If there's so much negativity and chaos in the world, but there's so many things that I'm thankful for and I can have gratitude about. So that's one of those things. Another thing is I make intentional time for myself during the week, whether it's 30 minutes, whether it's 10 minutes. It could be you at the gym. It could be you having your, jam session, whatever you want to do, and just putting those type of practices of things that are going to give me glimmers. That's a new phrase that I learned, because people talk about triggers, but glimmers are the things that bring you joy. So I'm become very intentional about incorporating glimmers daily into my life and starting my day with gratitude.
Okay. What about you, LaKonda?
I am a firm believer on identity, right? My identity is in Christ, and I make no excuses about that. But I recognize that my identity comes from Him and what I'm purposed to do. So part of my non-negotiable is when I get up, I have to value and speak into my life first. I cannot expect anyone else to speak what I don't do for myself, right? And so I have to remind myself who I am, and while I'm here every day, almost like the movie To Help, I'm kind, I'm great, I'm important, right? And so you have to affirm yourself first. And some people have to learn how to do that, but to affirm yourself and why you're here, because when you leave outside that door, there's a lot of devaluing and dismissing and disregarding. Right, but you got to come back home and do it again. Absolutely. This is who you are.
Dr. Newby, what do you do?
That's a good question.
We walk. I know that's one thing you do.
Well, I guess for me it's hard to say, because I live for other people. I never feel like I live for myself, so I'm always working to help somebody else. So I never really think about that. And when you thought about it, I was saying, man, what would I say to that? But my prayer life is key, for me, and that gives me peace. And then my physical activity, when I get out and do things, that's my second thing. And to be honest with you, my family is my third. When I need a break, I call my wife sometimes. I say, listen, I need to talk to you for a minute, just to get a different perspective. She gives me that peace I need sometimes in my life, that I know I can talk to her and she'll kind of guide me back to where I need to be. But that's really, for me, that's what I do. I live for others. My activity, my prayer life, and my family.
Thank you so much, Dr. Keith Newby, Dr. LaKonda Fanning, Danica Royster, Councilwoman for the City of Norfolk. I really appreciate this conversation, you guys. And before I let you go, audience, I want to tell you that the NAACP is holding a Ida B. Wells Empowered to Vote event. It is this Saturday, the 31st, from 10 a.m. until noon at the Chrysler Museum. It's a walk and conversations, and I believe, Danica, you are one of the speakers, is that correct, at this event? Okay, so she will be there. Come on out and show your support and get people registered to vote. And we hope that our discussion today has inspired you to take a close look at your own mental health and take proactive steps to get the help you need. Please share this show with a friend. Find our podcast at anotherviewradio.org, Spotify, or wherever you go for your podcast listening pleasure. Our theme music is an original composition created especially for Another View by Jay Sennett. Lisa Godley is our show producer. Jordan Christie is our audio engineer, and Dr. Barry Graham answered our phones. I'm Barbara Ham Lee. Have a fantastic holiday weekend, and let's get together again next Thursday at noon for Another View.
Support comes from Hampton Roads Community Foundation, carrying out your charitable wishes forever, whether it's helping shelter animals, feeding the homeless, enhancing the arts, or supporting students. Learn more at leaveabequest.org.